The desire to serve and protect and care for others was instilled at a really young age in me. So health just always seemed like a really natural fit.
I have a desire to change the face of health in this country.
I saw that ASU had a program and I saw that it was a really good program. So it was the best of both worlds. I got to be near my family and go to a really good school.
I just feel really loved and supported by ASU as a community, and there's so many opportunities.
Biomedical informatics really drew me into health because I was looking for something that would make a difference in the world. And I think the healthcare industry is one of the ones that needs a huge difference, and we're working towards that.
I wanted something that was more fulfilling. My business background was not giving me what I was seeking. So I want to get out in the community, I want to do policy, I want to make big changes.
When I first got here, I was a biology major for 2 weeks until I got to my intro biology class and realized that I didn't love it. I didn't like the molecular side of it, the small things that I couldn't see. I like the big picture, seeing how things move and how the body works, which is why I switched over to kinesiology. I knew that I wanted to do something in the science field, but I also didn't want to go into necessarily medicine. And I knew that I wanted to work with kids, so I thought that speech therapy would be a great field for me. I hope that I can impact not only these kiddos that I work with, but also their families. I mean, there's a lot of things that go along with having a child with autism or a child with Down syndrome or a child even with just a speech impairment. And I really hope that I can empower these families to advocate for their child and also help this child to advocate for themselves.
When I was in my Public Health 101 class, my professor, she talked a lot about her experience in the Peace Corps actually. And I think that really solidified a lot of things for me, kind of seeing the true implications of public health, like being in communities, working at the grassroots level to really improve health. And so that's actually where I'm headed after graduation. I'm in the application process right now for going to be a community health worker in Mozambique.
All of my instructors here at ASU have been so supportive. They're always there, you know, when I have questions, when I was really struggling in some courses, they were always responsive.
Fridays it's hard to get a babysitter for this guys. I've even brought him to class a couple times. Instructors sometimes say, oh, bring him to class next time, or don't even come to class without him.
I love that the professors are active in the community. I love that they're active in the fields of science and research and counseling. I love the variety of backgrounds that are featured among the faculty here. It really feels like a place of expertise.
I was coming in as a graduate student, as a master's level student. At the time, I was still trying to find my space where I fit, and ASU I knew was one of the places where I could have the ability to explore, to find that most adequately, and that led me to CHS.
I'm able to apply the stuff that I'm learning to not only myself, but to my career. Getting the physical therapy technician job too, I wouldn't have gotten it if I didn't come to ASU or be a part of the College of Health Solutions.
I feel like it's such a fun field and anything that I get into would be really interesting and really fulfilling.